You can be dangerously dehydrated while your water bottle is still half full. Thirst is late, and the scariest part is the early signs feel like nothing, a little tired, a little off. Hydration is not just water. It is water plus sodium, plus enough fuel to hold it where you need it. Ignore that, and the harmless symptoms can flip fast into real red flags. You do not need to panic. You do need to know when to act, especially when your body punishes you the moment you stand up. Moving to slide 2. If you get lightheaded when you stand, treat it like a warning, not a personality quirk. That head rush, the tunnel vision, the heart racing after you rise, those can be signs your blood volume is low, often from fluid and sodium loss, and it gets worse in heat. First move is simple. Stop, sit, or lie down. If you are about to faint, get your legs up and stay there until your vision and heartbeat settle. Then rehydrate with something that replaces sodium, like an oral rehydration solution or water plus a salty snack, taken in small sips. Avoid chugging plain water if you have been sweating heavily. If you actually pass out or you have chest pain, shortness of breath, or repeated near fainting, get urgent help. Feeling dizzy is bad enough. Feeling mentally off is worse. Moving to slide 3. Thirst does not explain sudden brain fog. If you are getting unusually irritable, anxious, clumsy, or you cannot track time and place, that is a red flag. In heat or after heavy sweating, confusion can mean dehydration is severe, or your sodium balance is off, especially if you have been pounding plain water without electrolytes. Do not try to muscle through it. Stop what you are doing, get into shade or a cool room, loosen tight clothing, and start slow sips of an electrolyte drink or oral rehydration solution. If you are alone, call someone. If you are hard to wake, clearly disoriented, or symptoms are worsening, this is emergency territory. Your brain is telling you it is not coping. A pounding head and nausea can be the next step. Moving to slide 4. A headache plus nausea or vomiting is not just I need more water. If the headache is new and severe, pounding, or feels like pressure, and you were in the heat earlier, treat it as a heat illness warning. Also pay attention to the pattern. If you drank a lot of plain water and the headache gets worse with nausea, that can fit low sodium as well. Either way, your move is to stop exertion and start cooling. Get to a cooler space, use cool wet cloths on skin, and drink small amounts of an electrolyte solution, not big gulps. If you cannot keep fluids down, if you are confused, fainting, or the headache is sudden and intense, seek urgent care or emergency services. Your body is past tough it out. Moving to slide 5. Urine is one of the clearest reality checks. If you have not peed for hours, or it is very dark, your kidneys are conserving fluid, and you are behind. If you are only passing tiny painful amounts, think dehydration plus irritation, or even a stone. Strong odor with fever can signal infection, not just concentrated urine. And blood in urine is not a wait-and-see symptom. For mild dehydration signs, start steady rehydration with electrolytes, and monitor for improvement over the next couple of hours. If you cannot urinate, you have fever, severe pain, vomiting, or any blood in urine, get medical help promptly. Do not try to fix that with more water alone. By the time your mouth feels dry, you are already late. Moving to slide 6. Dry mouth is a late sign. By the time your lips stay cracked, your saliva feels sticky all day, your eyes look a bit sunken, your skin is very dry, or your breath suddenly turns foul, you are not just a little thirsty. Your body is already conserving water hard. What you do matters more than guessing. Start drinking on a schedule, not by thirst. Use an oral rehydration solution if you have one, or a sports drink plus salty food if that is what you can tolerate. Keep urine as your feedback, aiming for pale yellow, not perfectly clear. If you are also getting dizzy when you stand, peeing very little, or you cannot get your mouth to feel normal after fluids, treat it as urgent. When dehydration pushes further, your heart often tells the story before you do. Moving to slide 7. A rapid heartbeat at rest is your body's alarm that it is struggling to keep blood flow steady. If you are sitting still and your heart feels like it is racing, pounding, or skipping, especially with weakness or lightheadedness, do not brush it off as anxiety. Low fluid volume, low sodium, low potassium, fever, and some medications can all drive this. Do a quick self-check. Sit down, breathe slowly, and take your pulse for 30 seconds. If it is staying high for you, or it jumps hard when you stand, that is a dehydration red flag. If you have shortness of breath, chest tightness, fainting, new irregular beats, or you feel confused, that is not a rehydrate later situation. Get medical help right away. If you do not have danger symptoms, start aggressive but controlled replacement. Small, frequent sips beat chugging. Pair fluids with electrolytes, not just plain water, and add easy carbs. If you are still racing after an hour of steady electrolyte fluids, or you are worsening, escalate care. When circulation is strained, muscles are often the next tissue to protest. Moving to slide 8. Muscle cramps that spread are often an electrolyte problem, not just tight muscles. If cramps hit after heavy sweat, then turn into whole body tightness, tingling, or hands that want to claw, pay attention. If weakness keeps growing and plain water does not help, you likely need sodium and possibly potassium and magnesium, not more water alone. Stop the activity and cool down. Start an oral rehydration solution or a salty broth plus water, taken in small, steady amounts. If you can eat, add something salty and starchy. Gentle stretching is fine, but do not force it. If cramps keep spreading, you cannot use your hands normally, you are confused, or you are also vomiting or having diarrhea, do not try to outdrink it at home. That combination can spiral fast, and your gut may be the reason you cannot catch up. Moving to slide 9. Diarrhea and vomiting become dangerous when your intake cannot match your losses. The big warning sign is simple. If you cannot keep liquids down, you are not rehydrating, even if you keep trying. If diarrhea lasts more than a day, or you have dry mouth with real weakness, you need a plan, not willpower. Start with tiny sips every 1 to 2 minutes. Cold fluids can be easier.
Oral rehydration solution is best because it uses the right balance of glucose and salts to pull water in.
If you do not have it, use a sports drink diluted with a bit of water, plus salty crackers or soup. Avoid straight juice and alcohol, and go easy on high-fat foods at first. Escalate quickly if you have fever with severe abdominal pain, blood in stool or vomit, signs of dehydration like very little urine or dizziness, or you are unable to keep even small sips down for several hours. That is when IV fluids and targeted treatment can prevent kidney injury and dangerous electrolyte shifts. Overcorrecting in the other direction with too much plain water can create its own problem. Moving to slide 10. Swelling with lots of water sounds backwards, but it happens when you overdrink plain water and dilute sodium. Puffy hands or face, a sudden weight jump, headache after chugging, nausea and confusion are red flags, especially if you are peeing clear nonstop. Stop forcing water. Switch to electrolytes and salt, and drink to thirst. If you are sweating a lot, pair fluids with salty foods. Do not flush it out with more water. That can worsen brain swelling. If you have confusion, severe headache, vomiting, seizures, or worsening swelling, get emergency care. Low sodium can become life-threatening quickly, and it is not something you can safely fix by guessing. Hydration is not just water. It is the right amount of water with the right electrolytes for your body and your risk level. Moving to slide 11. Some people get into trouble faster, and it is not about willpower. Older adults often do not feel thirst until they are already behind, and some also limit fluids to avoid nighttime bathroom trips. Kids have a higher surface area for their size, so they lose water faster and can crash sooner in heat or illness. Meds matter too. Diuretics push fluid out, and lithium levels can rise when you get dehydrated, which can quickly turn dangerous. Heart or kidney disease narrows your safety margin because your body cannot shift fluid as easily. Diabetes adds another layer. High blood sugar pulls water into your urine, so you can dehydrate even while drinking. If any of these fit you or someone you care for, treat dehydration as urgent, not optional. Moving to slide 12. If you think dehydration is starting, the first move is simple. Stop exertion right away. Do not try to finish the set, the run, or the yard work. Your heat production drops the moment you stop moving. Then cool the body. Get into shade or an air-conditioned space. Loosen tight clothing, and use cool, wet cloths on the neck, armpits, and groin. A cool shower works if you are steady on your feet. Now drink, but sip. Do not chug. Chugging can make you nauseated and can trigger vomiting, which loses more fluid. Take a few mouthfuls every couple of minutes. If you have been sweating, include electrolytes. Use an oral rehydration solution, a sports drink diluted with water, or salty foods with water. Plain water alone is fine for mild dehydration, but heavy sweating needs sodium replacement to hold on to what you drink. Keep checking your direction of travel over the next 30 to 60 minutes. Are you thinking clearer, peeing more, cramping less, and cooling down? If you are getting worse or cannot keep fluids down, that's a different category of problem. Moving to slide 13. Get medical help right away if there is fainting, confusion, or you cannot stay awake. Go urgently for chest pain, new shortness of breath, or a pounding, irregular heartbeat. If you are making almost no urine and feel weak or dizzy standing, treat that as an emergency. Blood and vomit or stool is never a wait-and-see situation. And if symptoms keep worsening despite steady fluids and cooling, do not push through. If this was helpful, subscribe for more evidence-based practical health guides. In the comments, tell me what dehydration symptom catches you off guard most often. This video is for general education only and is not medical advice. Insulin drives the system. Understand it.